My name is Solveig Magnusdottir and I'm a trained physician. I started my career in internal medicine, where I did spend a few years, followed by training to become a primary care specialist. And it was when I started to practice in primary care that I got interested in sleep medicine. So in 2014, I joined the sleep image team to work on developing a clinically valid, but at the same time simple and affordable solution to measure sleep duration, sleep quality, and to diagnose sleep apnea. Because in primary care, we have all these patients. We are not very technically savvy. So we need to have something simple, but we need to be able to measure sleep with the abundance of patients that have sleep complaints. And they do not only have sleep apnea complaints, they have general sleep complaints. So since 2019, the sleep image system has been FDA cleared and CE marked to evaluate sleep and to diagnose sleep apnea in children from 2 years of age, adolescents and adults, because you need the full lifespan to be able to implement this type of a tool into primary care. As I mentioned, I wasn't sleep trained when I started this. This started as an interest to improve access to sleep testing in primary care. And through this interest of mine, I was started by investing in a company that is in the sleep business that is called Embla. And it was through Embla I was introduced to my mentor, Dr. Robert Thomas. He is a neurologist and a sleep specialist at the Beth Israel Medical Center in Boston. And he is the co-inventor of the cardiopulmonary coupling technology, or CPC, like we call it, which sleep image patented and licensed. And we have been working on the commercializations for the past 10 years. So that is how I found out about this database that is quite amazing. First, we started by utilizing the database to validate the cardiopulmonary coupling technology. So we utilized the database, mostly the polysomnography studies that you have, as the sleep image system is FDA cleared as a software, as a medical device. This allows us to utilize a photoplethysmography signal that comes from PPG sensors or the electrocardiogram data and the SpO2 or oxygen data that you have in all polysomnography studies. So by extracting the ETF files, we could utilize this data to validate the system in the beginning. So by these data sets, we, for example, validated sleep duration. We validated AHI, that is part of the clearance that we currently have. But secondly, we have also utilized these databases to come up with research questions and utilize the databases to validate them to see if they have something to them or not by looking at sleep from the autonomic nervous system rather than from the EEG like we do in polysomnography. So we have published some of these analyses that we have done. And I think this is kind of much more interesting use than just to utilize these databases for validation. At least allows for like a second use of this data. As we all know, it takes a long time. It's very laborious, time consuming and costly to collect these large databases. So it is interesting to be able to reuse them, if you can say so. My main focus is to improving the solution for implementation in clinical practice. I'm a clinician at heart, not a researcher. But obviously, I have to put on my research hat in this job when I'm working on developing and validating the system. Because the vision of the company is to improve access to accurate sleep information at the population level to create opportunity for healthier people and a safer world through better sleep. So to be able to do this, we have to work on having a simple and low-cost devices to collect the data that we need. And we need to constantly work on improving the output of the algorithms and add some additional value to what we are offering to our clinicians and researchers. And one of our main focus is to allow for multi-night testing in patients' own sleep environment to be able to collect more accurate data to improve diagnostic accuracy and also to track efficacy of therapy with the aim of improving outcomes. So for researchers, this also allows them to, instead of collecting 1 or 2 nights of data, and now researchers that are working with the system are maybe collecting a month worth of data at baseline, and then they follow up with a month worth of data after implementation of some type of therapy. And what is interesting with this type of a simple solution is participants in research and patients also are very willing to do multi-night testing because it's so easy for them. So it offers us a more holistic view of our patients' sleep in a sense. I would encourage them to come up with research questions that they're interested in. Look at the databases that and you have very good information. It's very easy before you seek access to the databases to understand what you have in the data and what you can extract out of the data. And then if they find a database that fits their question, definitely ask for access and start working on your hypothesis and see what comes out of it. One thing that we can offer at the Sleep Image is that, and we are doing this for researchers that have access to your databases, is to do the CPC or sleep image analysis of your databases for them. And now they are utilizing your databases to come up with cardiopulmonary coughing related sleep questions, more autonomic sleep focused than EEG focused, and see what they come out with. I've seen one study that will hopefully be published soon that I find quite interesting, and that is a researcher who did exactly this. She came up with her question, she asked for access from your end, and then she reached out to us, and I've seen the final product that she can be very proud of. It takes such a huge effort and manpower and cost to collect these databases. So I strongly encourage everyone that is interested in research to sit down and see what else can we extract out of these databases with a additional hypothesis and research questions from what the researchers that did collect the databases, and reach out to them and ask them if they're willing to work with you. I think that is very important.